upon the help and support from other people to help them out in their caring duties, looking after relatives at home. And then turning to people that are very critically ill. Visits to the critically ill are very important as it gives them a continuity of relations, and family can have more time to care in a way that practically it is impossible for care assistants due to time restrictions. Many residents only have limited interactions with their residents because they have such a large number of residents to care for. So these isolation measures are actually removing the limited contact that many of the critically ill may have relied upon. Family can make contact, and I hope they do, through letters, telephone, and where they're able to, through online interactions. Yet, due to the conditions, some may struggle to use those methods of communication. The benefit of seeing friends and family regularly must be recognised. Why can't symptom-less relatives visit using gloves and masks that the staff are using? Those interactions would only be limited to one visitor seeing one resident. This is especially important for those with very critical or terminal conditions, whose times with their family may be limited anyway. Thus, it could have such an emotional and mental consequence and an effect on the critically ill, but also on their relatives. Well, according to a report from the nursing home, a report from the Partners in Caregiving, they said that they found that an effective partnership between family members and long-term carers is critical for the quality of care for all residents, especially those with dementia, though. And according to the Nursing Home Reform Act in the UK 1978, family members have a legal right to be involved in the care of their relatives. So obviously that's concerning for those people that were so critically dependent upon the visits from loved ones and visitors. Some people that may not be able to receive those, might be struggling more than others, one can imagine, especially those that are very critically ill. So there are a large number of different groups that may be potentially suffering and struggling in the short term. But if the lockdown does continue over a long period of time, one might expect that those different groups, those at-risk groups, might continue to struggle a lot more. So it's important, therefore, I would estimate, to look as much as we can at what things can be done to help provide support for the most at-risk groups during this critical time, but also to evaluate objectively whether those measures are in fact necessary or not. Whether in fact going through months of those measures is really something that is necessary to do or not. Well, in China, they haven't had those measures for many months. They've stopped those, and they report that the infection rates have now cleared up. They've reopened the schools, the factories, the care homes, and it's business as normal now as they've carried on with their lives. If you can believe those reports, that is, there are various reports with many different claims at the moment. So I'm still sort of looking into that at the moment. So I think there are lots of at-risk groups that we can look at, and lots of ways that we can help provide short-term care to help support those people through a difficult and challenging time. But I think it's also worthwhile investigating whether those measures are actually justified in the longer term, and whether it is necessary or not for such vulnerable people to be put through such trials of endurance. And potentially, there are potentially lots of risks. People are talking about the risks of going out and allowing people to socialize with the risk of infection. But I think what those people sometimes aren't always realizing is that prolonged isolation has got risks too. and it's got genuine and real risks to people with real mental and physical health conditions, to people in difficult relationships, to people living under pressure in domestic abuse cases, to people that are carers of vulnerable people, to children and adolescents, to people that are isolated and very dependent upon support groups, which they needed much more than others. Um, to those that may be vulnerable to crime within society. So there are a variety of different groups that may potentially already be suffering, and we're starting to see the evidence of that borne out in the data from a variety of different countries. So as this goes along, it's our moral duty to look at what the risks are of the long-term isolation on a variety of different at-risk groups, because it's all very well saying most of us are okay and we can cope with that. Well, that's a very Darwinian group. If you want to live in that society, survival of the fittest, okay. But what happens when you're a child, when you get ill, when you become disabled, when you are ill and in need of care and support from other people and are more dependent upon people visiting you and supporting you? Because that can happen to all of us. So I think it's our responsibility not just to be concerned about ourselves and I'm all right, Jack, but also to think and to think for other people as well as ourselves, and actually is something that in the very long term, if the measures went on for many years, is something that we ourselves would all suffer and struggle with, but potentially in the shorter term, over the next few months, is certainly something that at-risk groups would certainly suffer and struggle with much more than many other groups. So I think it's all our duty to sort of look into, investigate more, both what help and support can be provided, but also whether those long-term measures are really justified, and what kind of risks those are, because potentially we could be looking at thousands of deaths, tens of thousands, perhaps on a global scale, hundreds. Who knows? Who knows where this could go? Over many months. That's a possibility. So I think it's worthwhile trying to look honestly at that and weighing up the risks evenly. You can't just look at the risks only of ending the lockdown. You also have to consider the risks of continuing the lockdown, because they are there whether you choose to look at the data and the evidence coming out or not. And those at-risk groups do survive whether you choose to close your ears to their suffering or not. So it's a question of looking, researching things, trying to find as much evidence from different sources, and to consider what the context of those sources are. Are they reliable or not? And gaining enough evidence and information, talking to people from different backgrounds online, finding out how they're coping, what are their experiences during this process. I don't want to exaggerate the risks or worries at the moment, but I think there is a real risk of under talking and not looking and not considering what those risks are at the moment, and not considering at-risk groups if the isolation measures continue over a longer term.